Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Glad that you could join us today. Our guest today is Dr. Abhinav Sankineni. He's a gastroenterologist at MedStar Franklin Square Medical Center, and he's joined us today as a returning guest to talk about a new study that addresses the alarmingly rising cancer rates among young adults, and also a bit about some of the media attention that this new study has generated. Thanks for coming in today, Doctor.
Yeah, thank you for having me.
Great. Give our listeners a bit of background about yourself.
So I'm a practicing interventional gastroenterologist at MedStar Franklin Square in Baltimore, Maryland. Mm-hmm. My area of interest is interventional endoscopy. However, I do practice regular bread and butter gastroenterology, taking care of any problems related to the GI system, pancreas, bile duct, and liver. Thank you.
So as a gastroenterologist, your main focus, as you say, is on the GI system, the upper GI, the esophagus, the stomach, things of that nature, or are you dealing with colonoscopies as well when they're called for?
So we're doing colonoscopies as well. So I do esophageal problems, stomach problems, small bowel problems, and colon problems. And we do routine colon cancer screening with a screening colonoscopy to detect colon polyps and colon cancers.
Now, I do understand that there are some guidelines and some recommendations as to when people should, be checked for colorectal cancer and whatnot with a routine colonoscopy as you perform them there at MedStar. Normally, these guidelines are recommended for those of us in, 40, 50 years old and even older. But a new study suggests that maybe our younger population should become just as concerned as us older folks. Could you talk about this new study and how it relates to our young people?
Yes. So in general, for colorectal cancer is the second most common cancer diagnosed in men and women, after lung cancer. Of course, breast cancer is the most common in women and prostate cancer in men. However, colon cancer is not too far away from these, cancers. And it's also the second most common cancer-related mortality when you put men and women together. So in general, we recommend colon cancer screening in average-risk patients, meaning patients who don't have any symptoms, meaning no blood in the stool, no abdominal pain, no change in bowel habits, and no family history of colon cancer. We recommend routine colon cancer screening at age 50. So over the years, we've noticed that, we've been doing screening colonoscopies in order to detect cancers, colon cancers, early colon cancers, and also polyps at starting age 50. However, recently, about a month or two ago, there's a new study which was published in Journal of National Cancer Institute. And this study basically looked at the colon cancer incidence in patients, starting with colon cancer starting age 20 all the way to 85 years old, between 1974 to 2013. And we have interesting data from this study. So what we have learned is from between 1974 to 2013, incidence of colon cancer is going down in patients 55 years and older. That's great news. That means the screening program is working, and also maybe there's some risk factors for colon cancer which patients are avoiding. However, the eye-opener is patients 55 years and younger between this period from, especially from mid-1980s to 2013, the colon cancer incidence rate has increased.
Wow.
And the incidence of rectal cancer is quadrupled in this population. And this population that I'm talking about are millennials and Gen X. So patients who are, younger than 55, all the way to 20. So from 20 years to 55 years, the incidence of colon cancer has increased significantly, and the incidence of rectal cancer is quadrupled. So we don't know why, but, we've been noticing this trend.
Do you think that it has anything to do with actually testing people? Is this early detection, or is this detection of cancers in younger people that normally in the past just wasn't there to be detected?
We usually do procedures in younger patients only if they have symptoms. So most of them, who are younger, especially 50 years and younger, they must have had symptoms, and they were diagnosed with colon cancer. So the older population, meaning 55 and older, initially from 1974 to mid-1980s, the incidence of colon cancer was going up. But I think with the advent of the screening programs from the 1990s, the incidence of colon cancer has been coming down gradually. But this population, the younger population, I don't think they're in the screening program. As a result, the incidence of colon cancer is going up in them.
What are some of the factors that you believe are contributing to this rising in the incidence of cancer in younger people?
So overall, the risk of colon cancer is higher in Western population with the Western diet, low fiber diet, increased processed meat and increased smoking. So, and also over the last 2 to 3 decades, there's increasing BMI, childhood obesity, and adolescent obesity, and increasing weight in younger adults. So it's a combination of all these, possibly maybe, causing the increasing incidence of colorectal cancer in this younger population.
So the focus, I guess, on being healthy or appearing healthy as far as on the outside, you're going to the gym, you're doing, these exercises, you're trying to stay healthy as a young person, but your intake is contributing to the risk factor, even though you are doing other things to cast out other risk factors. Is that what's happening here?
Exactly. And in my practice, every now and then I see a young patient in their 30s or 40s or 20s coming in with symptoms. They look healthy. They're not obese. They work out, but they have symptoms. And I've done a routine colonoscopy, and I've found colon cancer in these patients. So, as you said, BMI or increased, body weight is, not only one factor. Possibly there's an interplay of the diet that we're eating, the smoking, and some genetic risk factors too. So maybe contributing, and these are all hypotheses, and this may be playing a role in the increasing colon cancer.
Does the success of treatment vary depending on the age and stage at which the cancer is discovered?
Yes. So unfortunately, when the younger patients present with colon cancer, by the time they have colon cancer, for some reason, they have advanced cancer, meaning the cancer has spread already beyond the colon, and it gets difficult when compared to relatively older patients. And, in general, it's, these patients, even though they're better surgical candidates when they have cancer, but, the cancer characteristics is different in this younger population than older population. They're more aggressive cancers in the younger population.
And do you think that is attributed to diet as well? And, or maybe some of these new genetic factors, some of these factors as far as genetics, could they be newly introduced, say, in the last 20 years?
Possible. And, and we need to do more studies to understand what's going on in this younger population. Because if you look at the overall history of colon cancer, like the earlier part of last century, early 1900s, the incidence of colon cancer was pretty high. And then mid-1900s, around 1950s, the incidence of colon cancer came down. And then again, the risk of colon cancer is back to what it was in the beginning of the century, and we don't know why. So, and we need to do more studies to understand what's going on, especially in this population who are not in the screening program, and why are there increasing risk of colon cancer. So we know that it's, weight may play a role, for processed meat, low fiber diet, smoking, but there's something else going on in this population for which we need to do more studies. And possibly, we have to identify the high-risk patients and start them doing early colon cancer screening in them.
Yeah, that sounds like a huge factor in early detection and treatment. Now, where can our listeners go and get some more information about MedStar Franklin Square Medical Center and this latest in the colorectal cancer study?
So they can go into the MedStar Health website, and they can Google MedStar Franklin Square. And we are under Center for Digestive Disease at MedStar Franklin Square. And we have all the information of all our providers who routinely perform colonoscopies and endoscopies. And we have all the biodata of all the providers.
Great. Well, thank you so much. Some great information, and I'm glad that you could come back and share your time with us again, Doctor.
It was my pleasure. Thank you.
Great. You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. Abhinav Sankineni, gastroenterologist at MedStar Franklin Square Medical Center. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.